will be back. He's going to talk about caregiving from a physician's perspective.
He's good too.
He's very interested in the relationship aspect of caregiving and care, the person that we care for, and the relationship and how that dynamic is so crucial. And he's also really holistic, health oriented. So when he starts talking about dementia, he said, you really can't isolate really brain from body. It's all part of the body. It's all part of the human system. So his presentation, I'm sure, 2 weeks from today will be really good. And then we will meet on November the 16th.
15th.
No,
15th.
We will meet on November 15th. We will also meet on the 16th. The 15th is our Memory Cafe.
Okay.
Thursday, the 16th, will be one of our usual programs. So I'm remembering that on my head, and I think that's correct. So
What is the program that, do you remember for that week?
that one is still being planned. We've got
Okay.
somebody that I've gotten in mind to ask for. We've not done it. But anyway, to let you know that 2 weeks from today, Dr. Dahmer, that is committed. We are going to be starting, yes, Jeff?
your email was November the 9th and
And the
November the
30th.
30th.
Okay, so I've been corrected.
I'm not trying to correct you.
No, you're right. No,
That's
I
why
said
I'm
November 16th, and I thought, I don't think that's right, and then so anyway, she's correct. The email is
It's
correct.
not the 16th.
November 9th, we'll have a program, and then November 30th. We have the Thanksgiving, and so that kind of challenges us to have our Thursdays in the right order. But we're really excited to have the Memory Cafe program starting. We're going to do a small group, just to kind of sample and see how we're going to do with it. We had our training this morning with 25 people, and our first session is going to be on November the 15th. That's the 15th, and that's a Wednesday morning at 10 a.m. Wednesday morning at 10 a.m. on November 15th, the Memory Cafe program. All of our programs are on our website, so if you want to know anything from the various seminars, I think we've now done 16 or 17 of them. They're all on the website. There is one there specifically with Regina Ford talking about the Memory Cafe. And I will show that, have that sent out again. So it's a great place for us to store that knowledge, the insights that we have from these various people, and which we'll get today again. So it's my pleasure to introduce to you the Reverend Dr. Ken Bensen.
Thank you. Thank you. Well, I'm happy that Dr. Johnson is going to be able to join me in a few minutes to talk about his experiences with hospice as a medical provider referring people to hospice. For those of you who do not know, I have been a hospice chaplain for 7 or 8 years, dealt with, I guess I have to say, hundreds of people that were in the process of dying. If they're not in the process of dying, they don't get on hospice. So I would deal with them. And I quit for a while because I got into, I won't say conflict, I just didn't like the way the CEO was running things. And so I decided I don't need to do this. I can spend my time doing something else. Well, they fired him. But before they fired him, they called me and asked me if I would come back as a chaplain. So I'm back now as a hospice chaplain. I want to tell you a story to begin with. Dr. Johnson's going to conclude with a story. We'll see who has a better story here about hospice. My job as a hospice chaplain is to make sure that people are at peace with God and they're ready to die. That's my job. I met with a woman yesterday for the first time, has dementia pretty bad, but as soon as I mentioned God, Asked her if she had peace with God. She said yes. That's the only conversation we had. Nothing else could she respond to. But she did respond to the fact that she had peace with God. But now the other story. This was a few years ago. Now I've been going into homes for over 60 years, visiting people. And you get into all kinds of homes. You get into homes where you can just walk down a path and the stuff is piled up on either side. And you get to go through this. Well, this was the worst home I have ever been in. What they should have done was bring a bulldozer, bulldoze the house down, put it all away. But there was a woman in there that was dying. And she was in a bed. She had a niece that was taking care of her. She was on hospice. Well, anyway, I got a call from the head nurse, and she said, go immediately there because this person is actively dying. So I went there and I walked through the paths and got back into the room where the woman was. And my standard question to begin with is, do you have peace with God? Now, I can't say, are you a Methodist, Catholic, Seventh-day Adventist, whatever it is, because we all have a different pathway that we take, and we get to the same point. It's just that we choose a different pathway. And this woman said, no, I'm going to hell. Now, she's actively dying, and I go in and say, do you have peace with God? And she says, no, I'm going to hell. Well, I said, if you're so sure you're going to hell, I think we need to have a conversation. No, there's no conversation. I'm just going to hell. I said, well, let me talk to you for a minute. Why are you going to hell? She said, my mother went to church every single Saturday night. She was a Catholic all her life. I couldn't do that. She was a police dispatcher. She had to work Sundays. She had 2 boys. So she had to work to take care to support her family. And I said, well, you know, the Bible I read doesn't say anything about going to church. What it does say is we need to confess our sins. We need to believe in Jesus Christ as our Savior. She said, oh, I've done all that. I said, well, in my mind then, you are not going to go to hell. It doesn't make a difference whether you went to church or not. You believe in Jesus, you confessed your sins, I think you're going to heaven. So I said to her, you think about what I've just said. Don't stay very long in these kinds of situations when they're dying. And I said, I'll come back tomorrow and we'll talk. So I went back the next day and she said, you know, I've been thinking all night about what you said and I believe I'm going to go to heaven. So we had a prayer and I left and I went back the next day, which is very uncommon. I don't usually do that. Came into the room and she said to me, am I going to have to work in heaven? She died 3 hours later. And I was able to, the family asked me to perform the funeral service. And so just an interesting story of things that happen when you're dealing with people and they're dying and you need to make sure that they're going to go to heaven. Now, the reason why I wanted to talk today was the fact that we throw this word around, hospice, very loosely. And we talk about hospice, and what does hospice really mean? But before we get to hospice, I'd like to talk about palliative care. Palliative care comes before you move into hospice. And palliative care refers to the day-to-day care of emotional and health support. Palliative care means that you're going to continue on with your doctor, but you're also going to continue on with your treatment, as opposed to hospice, where your treatments stop. And the only thing you do in hospice is to provide care so that you will not be in pain or suffering or whatever it is. So I think palliative care is one of the systems that's available to us in this country that is completely and totally ignored. Now, the hospice that I'm associated with, we have palliative care and we also have hospice. And frankly, unless I read the records real carefully, I don't know whether they're under hospice or they're under palliative care, because we're doing fundamentally the same thing. But we have not stopped medication or treatment. We are giving them their medical care that they need in order for the process to work and for them to get healthy once again. And I might say that oftentimes people who get on hospice get better because they get the kind of care and treatment that they need. Even though they have taken away the medicines that are supposed to make them well, because of the care that they're giving, the support that they're being given, they oftentimes get better. And then it is necessary for them to come off of hospice because they do not meet the requirements. Now, palliative care is free if you're on Medicare. Medicaid, I get those two words mixed up. What is it when you get to be 65? Medicare? Yeah, it's free. Doesn't cost you a thing.
Oh, no. Medicare's not free.
I'm talking about the treatment that you get.
Okay.
Doesn't cost you anything.
Right.
Because you paid a premium, and I understand that, and you paid a premium, so it's like an insurance policy, but it's free. And people don't realize this. They wonder, how much is this going to cost? Now, what do you have at your beck and call when you're on palliative care? It's the same team that you're going to have if you're on hospice. You have a medical director. You stay with your medical doctor as opposed to hospice. You lose your medical doctor and you go to the doctor that the hospice has. But you have your medical team. You have a nurse that comes around. You have an aide that comes around on a weekly basis. And we just brought somebody on yesterday. The aide's going to go 3 times this week to see that individual and to help with the family and the needs that they have. So then you have a social worker. And I personally believe the social workers are one of the key factors in this whole process because they understand the system and they can work you through that system in palliative care where you and I and the doctors don't have time. I don't know anything about it, but they take and work you through the system and help you as you have to navigate all of these idiosyncrasies that come with regard to palliative care. And then you have a chaplain, and that's where I come in. Now, you can reject any one of these, or you can accept them. That's your choice. When I was a pastor and someone in my parish would come on hospice, I suggested right to them that perhaps they not take the chaplain, because why would you want to bring another person into their spiritual life when you've known them and they've been part of your parish for a long time? I wanted to do the work that a chaplain would do. But I can tell you that over 90%, maybe more than that, of the people that we work with, the pastors never come. They never come and see the patients. And I have called more pastors than you want to think about in the city of Tucson, and they never come. So that's where the hospice chaplain comes in, because the pastors are not doing this. And of course, a lot of people are not church. They're unchurched, so they don't have anybody. Now, I'll say this too, right at the beginning. In the hundreds of patients that I've had over 7-8 years, 3 have not believed in God. 3 did not have peace with God. There's something about it when you know that you're dying. No matter what kind of life you've lived, you're going to make peace with God because you want to go to heaven and not to the other side. And I can tell you that almost 90+% of the people I've dealt with believe in God. And I never, other than a few, have them refuse to allow me to pray for them. And they welcome it. And I talked about this woman yesterday. When I asked her if I could pray, I got another response. Oh, yes, you can pray for me. So that's palliative care. It comes before hospice, but has many, many of the same features in it. And it's something that's being ignored. And if you are a caregiver and you've got all kinds of people out there that you're taking care of, to have a caregiver or have somebody come in and help you and assist you, shower them, change the beds, help them with meals, what have you. This is what palliative care is all about. And I would encourage you, and you can share this with your friends, if you need additional help, look at palliative care and see if you cannot get this to come to your place. And they'll come right to the home. You don't have to be in a nursing home or a hospital or anything. They'll come right to your home, and they'll come and they'll determine, they'll set up a program for you, and they'll determine how long and how often they should come. And again, you need to go through your doctor, your primary care doctor. Now, if the primary care doctor doesn't necessarily want to do this, you can call one of the hospice agencies. They have medical doctors on their staff, and the medical doctor can assess the situation and can put you on palliative care, even if your own medical doctor, your primary doctor, doesn't necessarily want you to do this. So now let's turn to hospice. Palliative care comes before hospice, and it's very, very important. What are the criteria for hospice? You hear this thrown around, you're going to die in 60 days, right? Or 60 days, 6 months? 6 months, you're going to die in 6 months. Well, I've had patients that have been on for 2 years. And we'll talk about the process. So just because you go on hospice does not mean that you're going to die in 6 months. Now, the medical people feel that you're going to die. They feel there's no more, you're not responding to the care that you get, or the medicines that you're getting, you're not responding to that. So we'll put you on hospice, and they will allow you to be comfortable. They'll help take care of you during this period of time, relieve the stress on your family, and they will help you. First of all, then, you need a certificate of illness. The doctor has to determine that there's a high probability, and I'll use that word, high probability, that you're going to pass within 6 months. But that word high probability, that's exactly what it means. It's not written in stone. What are the 3 indicators that the doctors look at? The patient's lack of improvement despite treatment. Nothing's happening. Everything is just staying the same. Second, the patient's goal is to become comfortable rather than a cure. Because they've tried this cure, they've tried everything that they can, and now they come to the point where they have said, and the doctor has said, there's nothing more I can do for you. Let's make you comfortable. And the third one is some acute event that happens within your life. I've had young people, 28, 30 years old, be involved. One man I remember now was involved with a motorcycle accident, and he was on hospice. And he lived for about a year, but he was not going to get better. So something has happened like that causes you. Lack of improvement in spite of therapy, Patient's goal is comfort in some serious event that has happened to you, like an accident or stroke or heart attack. Now let me go through some of the things that are commonly found when we bring a hospice patient on. Frequent hospitalizations in the past 6 months. Significant weight loss, 10% or more in the past 3 to 6 months. Change in mental, cognitive, and functional abilities. Increasing weakness and fatigue. Decreasing appetite or trouble swallowing. Inability to complete daily tasks like eating, bathing, dressing, and walking. Recurring infections or increasing pain. Insufficient hydration or nutrition. And then the one where you have a desire to stop treatment and not go to the hospital anymore. These are sort of the things that the medical doctor or the head nurse will look at as they decide to whether to bring you on as a patient or to tell you to wait a little longer. Now, as I've said earlier, the whole purpose of hospice is comfort rather than medical care. To keep you comfortable as long as you can, to make your final days on this earth as easy as they possibly can be, improving the quality of your life. Now, oftentimes, the individual who is ill is not able to make the decision. And here is where it becomes so important that we have a medical power of attorney. Someone that can make this decision for us as we begin to move into our difficult times. Hospice can be stopped at any time, but you can also come back at any time. And we have families who want to take their loved one out. They think they're getting better. They want to be part of making sure they're at home and this type of thing. And they leave hospice, and they make that choice. But you can also come back anytime you want to. Now, what happens when you're in hospice for more than 6 months? Sandy, my wife, was a volunteer with hospice for many years, and she had a good friend that she went to see a couple of times a month up in Tucson. She was 99 years old. Well, probably when she started, she was 97, 98. She was on for 2 or 3 years on hospice, and Sandy would go and they'd have a wonderful time. Immediately after turning 100, she passed away. She had that goal to live to be 100, and she made it, and then she left. But Sandy went as a volunteer. I went as a chaplain. The nurses and the doctors were in there on a regular basis. Again, not to make her well, but to keep her comfortable. So what happens if you need to be on hospice for more than 6 months? First of all, let me tell you, you're not going to be thrown out. They're going to keep you. And you have to show signs of continual decline. Loss of weight, not eating. There's a set of criteria that the nurses and the doctors use. And if you meet those criteria, then you can stay on, as this woman did for 2 or 3 years. She met the criteria. There was a continually decrease in her health and her ability, and she was able to stay on. We have a meeting every Friday morning, every other Friday morning at 8 o'clock, and we call it an IDG meeting, in which we go over every single patient and we talk about them. Each one of the disciplines talk about what's happening, what's going on. If the person's time is coming to an end, we talk about that. Are they going to qualify? What do we have to do to qualify them? What do we have to do to take them off? Those discussions go on every 2 weeks. And so every 60 days, After your 6 months is up, you are recertified. And then you can continue to stay on. Now, if you don't get recertified, you're getting better, you're off the program because you do not need to be on it. Now, who provides hospice care? There are hospice organizations all over, many of them here in Tucson, in the Tucson area. Well, let me talk about the personnel. I've already talked about this a bit. First of all, there's a doctor, a medical director. And then we have RNs, regular nurses, and then we have nursing aides that go out. We have a social worker. We have a nutritionist. We have volunteers. And then we have a chaplain. Now, all of those people, when you're on hospice, are available to you at any time. And if you're on Medicare, it's not going to cost you anything other than your insurance. It's all free. And it comes to you. You don't go to them, but they come to you, and they come to your house. Now, some insurances, if you're less than 65, and I don't know if anybody in here is below 65, maybe you are, you could have an insurance policy that will cover this as well. So it's not just Medicare, but you can have an insurance policy that covers this one. How do I get hospice? Call one of the organizations, talk to your doctor. My experience has been that most doctors have a hospice organization that they like to work with. And I would suggest that you pick that particular hospice because they're going to be able to communicate with your doctor back and forth, and rather than going out. Now, sometimes you don't have that choice, but you can do that. Now, let's talk about what they do, what we do, what this team of people do. First of all, I've talked about the personal care that you get. Into your house, at the time of death, I get called out many times in the middle of the night. There's been a death, and it's especially with the Spanish people. I've gone into hospital rooms or rooms no bigger than a hospital room, and there'll be 30, 40 people in there because grandma has passed away, but they want a chaplain to come and they want us to have prayer with them. And we'll talk more about the funerals in just a minute. So personal care. And it's what you need, not what's prescribed by some bureaucrat someplace along the way. The Medicare or the hospice people have a right to decide what you need. And you can work and negotiate with them to find out what you should have. Medical supplies and equipment, hospital beds, wheelchairs, walkers, whatever you have. Again, it's just brought to your house and it's there. Then when you pass on, if you're still living in your house, they come and pick it up and take it away. That's the way that works. Then we have therapy and nutrition. The social worker can offer not only to the patient, but also to the family. And I have to tell you, as a chaplain, I work almost as much with the families as I do with the patients, because I help them in this process of working through the death. Now, this comes to your house, if that's where you are. But you can also be in a nursing home. You can be in some kind of extended care facility, wherever you are, even a hospital. Now, the hospice that I'm with, we do not go into the hospitals. We discharge you when you go into the hospital, and then when you come back, we bring you back on. But hospice can work in the hospital as well. Now, there's another thing, another gift, I think, is what I call it, called respite care. You are taking care of your spouse, your grandmother, your mother, your wife, your husband, and you are just simply worn out. You can't take it anymore. Hospice has what they call respite care. You can go away for a week, 2 weeks, visit children, visit family, stay at home, clean your house, do whatever you want to, and they will take the hospice patient and put them into a facility for that period of time to give you a break so that you don't lose everything you got and get sick yourself. Respite care is very, very important. And in the hospice that I'm with, we use this frequently to allow the people that are taking care of them at home a break from the stress and strain that they have at that time. Now, I've talked about where we can get care, your personal residence, but hospice does not provide for around-the-clock care. They come in and they leave, but they can stay 2, 3, 4, 5 hours if that's what you need, and they will do that. But we do not provide around-the-clock care. And then we have an independent hospice facility. I like to call that a hospice hospital. Now, when my first wife died, you know me, I could not take care of her. That's just all there was. I could not take care of her. She'd been in a nursing home. She'd been in and out of the hospital. And finally, the doctor came to me and he said, we need to put her into a hospice hospital. And that's where she went. And she stayed there then until she passed away. And part of the reason, I have to be honest with you, why I'm so interested in hospice and why I became involved was the care that they took of her and of me. It was just really, really wonderful. So, and then I talked about the hospital, but I don't know of anybody that takes him right directly in a hospital. They will take him into a hospice hospital, and that's different from a regular hospice. Now, I'd like to talk just a few moments about getting ready for death. I can still take you back on 22nd Street by Kolb Road, if you know where that is. When my father was getting ready, he had retired, he came down and spent the winter with us. I had a church on the east side of Tucson at that time. When my father and I were going to the hardware store, I remember what we were buying, but my dad said to me, I'm going to die in a few days. They were leaving Tucson to go back to Nebraska. I said, oh, Dad, you're crazy. You don't know what you're talking about. You're sicker now than you've been for years. Everything is fine. They got back to Nebraska, and they were looking at renting a house. My father found an old lawnmower in the yard or in the garage. He was pushing that lawnmower. And all of a sudden, there was no more noise. My mother was in the house with the windows open, and she looked out, and my father lay dead behind the lawnmower. He knew 3 or 4 days before he died that he was going to die. I am convinced with all of the people that I've worked with in the church and in hospice that we know when our time is coming to an end. And we need to prepare not only ourselves, but we need to prepare our families for our time that we're going to go. Now, I was 32 years old when my dad died. I wasn't ready for this. He and I were just beginning to talk as adults because I was beginning to relate to him, he could relate to me, and then he was gone. And I never have had a chance to ask him a whole lot of questions. So as someone who has someone in their family that is passing on, give them a chance to talk. Give them a chance to share with you their love, their compassion, their understanding. And I think it's good if you can acknowledge the fact that they're dying and let them know that you know it. Question the meaning of life. Discuss these deep things with them about life and where you're going and what you're going to do. Allow them to talk if they want to talk. Allow them to be silent if they want to be silent. It's their time, not yours. You're there to facilitate that. I just made a trip to Denmark. My whole family lives over there. I have a brother, most of you know this, and a cousin in this country, and that's it. Everybody else is over there in Europe. I went over there and I said goodbye to 49 of my family members. Now, I'm not ready to die. I hope not, anyway. But I know that my health is not strong enough to make another trip like this. So we were over there. And my one cousin that's my age, that we've been together, I don't know how many times, 20, 30 times I've been over there. She said to me, "This is the last time we'll meet on this earth. We'll meet in heaven next time." Be active. Don't shy away from this. Don't be afraid of what you're going to say. Say what's on your heart and allow this to become part of your process. The other thing I would say is as you know you're dying, you're in hospice, be active in your own medical care. Make some of the decisions if your mind is okay. But if it's not okay, make sure that before your mind didn't become okay, you shared with your family or whoever your power of attorney is, medical power of attorney is, what you want, so they know. Be tolerant of your physical limitations. And don't be afraid to reach out for support. Now I'm going to get on a soapbox. And this is me. As you know, and I know, we're not having many funerals anymore. We're not having many funerals anymore. People die and they just go away. I've checked around the country. It's happening here, and I thought maybe it was a culture here. But I was in Michigan a few weeks ago. Were we a few weeks ago? I was up there. I don't know. Anyway, I was up there talking to them, talking to my clergy friends. Same thing's happening up there. We were in California last weekend, and there were people from all over, 14 states. And I talked to them, and they're not having funerals. When I was a pastor, 22 years old, had my first church, first funeral, I thought it was barbaric. And I did not like it one bit. But as I continued on in the ministry, I began to realize that funerals are absolutely essential for bringing closure to a person's life. And I would encourage you, and I'll say this to anybody that wants to talk, we need to have funerals. And someone says, and I hear this often, "Oh, I don't want somebody looking at me when I'm in a casket." It's not them. They're gone. It's you. And that's my soapbox. And I really feel that you need to provide a way and a means for you to have a funeral for your family, for your friends, because it brings closure to their life. I could tell you a lot of stories, but we're going to call on Dr. Johnson now to tell us about his experiences. You've listened to me. Now he'll talk to you about his experiences. Do you want to turn around and you can sit right here?
I think I need a place to put my elbows.
Right here. Sit right here. We'll turn it around.
Well, then I face the wrong direction.
Well, no, sit here. Turn in and sit here.
I'm gonna put this microphone on you so we can hear you, or the recording can hear you. So let's get this going.
Well, I can start right here.
All right.
Okay,
Well, you need a microphone.
I got one.
Yeah.
I got
Why don't you
one.
sit
That's the
here?
recorder.
No, I want to stay where I am.
You want to stay where you are? Okay.
Yeah, all right.
You can all see him. And he,
See the back of my head.
Why don't you turn around, Doc? I'll just turn the chair around and get that.
Well, I have to do a little bit careful with this.
there you go.
Let's get your horse right in
This is
the
my
right spot.
speech.
Nope. That's about as far as I
I'll
want
give
to
you
go.
one.
All
You
right.
share.
Okay. I'm Dr. Richard Johnson, a retired internist, practiced all my career in Missouri, went to University of Missouri, and,
Can you hold that?
yeah, sure.
Just hold that up there. Thanks.
And I've got a couple stories to tell you. One of them was when I was
There's
practicing.
one talk.
I had a patient who was nearing terminal state with lung cancer. And
put
he
it up
lived
on the screen.
nearby where I lived, and I would go visit him at his house during this period of time. He said, this is really tough on my wife. I don't want to die at home. She couldn't take it. When the time comes, I want you to tell me it's time to go. And if I want you to take me to the hospital, you'll do it, won't you? And I said, yes, I will. He called me one day and said, this is the time's coming. I want you to come over to my house. And I did. Sure enough, he was right. And I told him, I said, Tom, it's time to go to the hospital. And so he loaded up with me and we went to the hospital. His wife took herself to the hospital. And he was in a semi-private room and she was in a waiting room on the end of the hall because she didn't want to be there while he went through the last stages of his life. So I sat with him and I started an IV, so I let the nurses think I was doing something. And he just laid in bed with his head propped up, and I sat there with my finger on his pulse, seeing what he was doing and all. And finally, he had a violent throw, and his breathing was really stertorous, and I knew at the moment had come. And why, son of a gun, he sat right straight up in bed, looked at me square in the face, did this, and died.
Oh, God.
Put your mic.
Arlita has a story about her mother that when I get finished here, I'm going to ask her if she would relate that story about her mother's hospital experience. And so I'm going to talk a little bit about hospice. We had a neighbor who would walk his dog almost every day about the same time past the front of our house. And he was a tall, skinny guy, and he was getting slower and slower and slower as he walked by the house. And he just looked like he was alone. So I made a point to go across the street and meet him one day, and decided that he was alone. He told me he lived alone in a little old house with a dog, and he was retired and had been to Europe for surgery because he thought he could save some money by going to Europe for surgery. Well, they almost killed him. And so here he's back on oxygen 100% of the time. He had an oxygen generator at home, and he had a hose that he'd trip on to get to the bathroom in the middle of the night because that was his oxygen. Ooh, I hit myself in the nose. And I would go to visit him at his home, and he and I would talk about all kinds of things. And one day he said, I don't want to live this way any longer. And he looked at me and I said, it's your choice. And we didn't discuss the possibilities and things like that. I just left it up to him. He decided. And he did. And so he had contacted a hospice facility. I don't know which one it was, but we had a meeting at his home. A bunch of people showed up, a lawyer, some administrators, a couple nurses, and myself. And we signed papers. I don't know everything I was signing, but I signed them all. And then we sat in the living room for a bit, and he looked at me and said, I think it's time. I said, okay, if you're ready, we'll proceed. And so we walked back to his bedroom where he crawled into bed and said, Doc, I got something for you. Before we finish all of this, I want you to take my watch. And I did. I don't know whatever happened to it, but I did. He wanted to give it to me. Laying on his table in his bedroom was a Bible that was open. And my wife felt that he was unchurched. He was unchurched, but somewhere along the line, he found the Bible. So we started, and we had to give him sedative to relax him so that we could finish the terminal act of the time I spent with him. And my wife, being a nurse, administered the morphine drops to him under his tongue, and a dose that I would tell her how much to give him. And so I monitored his condition, how was he getting sleepy or whatever. And finally, he drowsed off. And I looked at him, and he was perfect for this moment. And so I went into the other room and I unplugged his oxygen. That's the terminal event. And it wasn't long. And he silently slipped away, quietly died. And that was it. The nurse came to check him and to take back what medicine Arlita had not administered to him because that was a narcotic, and to make other arrangements. And he had one family member that she called, and that was it. Poor guy, he had one family member. Anyway, that's my story about my friend. And he and I would go during the week, we'd find a coffee house just to go sit, have coffee, and talk about stuff. And we talked about everything. It helped him a lot because he didn't have a friend to talk to. Anyway, we finished it together. And I'm proud to say that I helped him. Let me think a moment. Arlita, do you want to tell your story about your mother? Okay. There's your microphone behind you.
You get your microphone. This is a microphone to record it in the video camera. Let's put it right here. Technology is wonderful.
All right, I have two stories about my mother. She had fallen in a rehab center, and she was supposed to be attended at all times when she was up. They took her to the bathroom, left her there by herself with her walker. She turned around, the stool wasn't flushed, so she flushed it, but she fell against the shower pan, shattered her humerus, broke some ribs, and her pelvis. So she was in agony. They transferred her to an acute care hospital. And when she was in there, she was just so anxious and irritable. And they transferred her to critical care. And while she was there, we had our pastor come. And there was a lot of family there at the time. You want me to hold that?
Sure.
Okay. Anyway, we held hands around her bed, and the pastor said a wonderful prayer. And at the end, he said, "We're standing on holy ground." And at that moment, all of Mother's anxiety left, and she was at peace. But it's hard for me to talk about that. But anyway, she stayed in that hospital in probably 2 weeks, and she was in agony. We couldn't transfer her without pain. She couldn't do anything without severe pain with all those fractures. And she told her doctor, "I'm ready to die." And he said, "Will you talk to your family tonight? And we'll talk about it again tomorrow. But if I stop your heart medicine, you will die. But be sure you talk to your family." So anyway, we all talked about it. And Thanksgiving was coming up, and she said, "I can't be at Thanksgiving with all the family." And she had made up her decision. She wanted to die. So Dr. Schutte came the next day and talked to her, and her medicine was stopped. And then we waited, I don't know, quite a while before she died, but she was at peace. She was at peace when she died. So, but it's hard to talk about it still. It's been 20 years, probably. Yeah. She couldn't hear. Okay.
Here, Jerry. You close this out, Jerry.
That's it.
Can we talk a little bit about that? About what you can do? I mean, I just signed some papers
If
for
you want to hold them
my,
both like this, you can.
all my last will and testament that I didn't want to, live if there wasn't, help. That I didn't go on living if there wasn't, any way that I was going to get better. But I hear things about it. Is you have to have a doctor sign these things? What is there a legal way that you have to do this if you choose to die?
It's your final appointment of your person who's going to take care of you after the time of death, and then you express your wishes in that. You don't need a lawyer to sign it. A lawyer will draw it up and it'll look really nice and be legal, I would say so too. Doctors do not have to sign that. It's just that you need to have your own peace of mind that you've done the right thing, and the family and your family, will be taken care of. You've done your job.
Okay.
Talking to your family is crucial, so that
Right.
whoever your medical power of attorney person is, right, Doc?
Right.
That would be right, yeah.
Right.
So that is really explicit and careful. Dr. Dahmer will probably talk a little bit about that. I know just on the side, he and I talked about being as explicit as possible.
Yes.
What is it that means extraordinary care? And he had an example that was amazing. This guy was on about 4 life support systems, and they were going to put him on another one, and he was the resident, so he came in, and then he said, well, the wife came down too, and she had given in to everything that any medical doctor had suggested and had done everything, right? And he said, now this would be extraordinary means if we did this. And she said, well, we don't want any of that. Well, he was already on 4 life support system things. So, you know, really, some people say in general what they want, but then it's becoming specific, my understanding of what you need to be clear about, you know, what you'll accept and not. And that's where the doctor and the family are so important. What we miss today is having that family doctor piece. It's so much different now in our systems. Yeah.
Well, Jerry, that's why I said the hospice, if you feel that way, we have doctors who are hospice doctors who will look at this perhaps differently than what your primary doctor will do.
You're exactly right. And I think there's really been a change too with doctors in relationship to hospice. You know, my brother was an endocrinologist, and he was very reluctant to call hospice in until, you know, more recently. And then when he ended up, you know, in a terminal situation, he got on hospice, and he said, these nurses are angels. He was so delighted for that. You want to make a comment? I don't know, maybe you have some comments too. Yeah.
When my father passed away, he was in a hospice hospital. My mom took care of him until that time where he had to go into the hospice hospital. And she went in every day and fed him. And it was a mistake for her to do that because that made him linger longer. But I want to say that I really believe that the last thing that goes in your body is your hearing. Because he heard my mother and myself and my daughter were not going to be with him in the morning. And he always said he never wanted anybody of the family to be with him when he died. He died that morning.
Wow.
So they hear what you're saying.
Oh, yeah, absolutely.
And I think you're right. People will linger sometimes and keep living because they think the family wants that. And then the other thing happens is the family feels like they need to be brave for the patient, and in fact, they don't talk.
Mm-hmm.
So I think that was one of the first things I did
How sad.
when I was a chaplain was, you know, get this couple to talk about the cancer that, you know, they were dying. And they were a loving couple. They talked about everything in their life, but they had never talked about, you know, what it meant for him to be dying and for them to say their goodbyes. And so I was able to help them get to that point.
Well, I thought that because I signed that I made the choice that,
Hold it closer.
yes, that
Hold it closer.
I thought that when I signed that I was in control, and if I didn't, then other people could override it.
Mm-hmm.
But that's what I felt when I.
Right. Right.
Probate,
What?
it's probate. Overrides it.
Probate?
Probate, yeah. And that can take a part of your document because out of your hands now, somehow, some way. So you get a good attorney and say, I want my will, and I want to avoid probate at all costs.
Oh.
And I did, and they did. And so I'm happy with that. Just something to think about if you want to maintain the value of your estate.
Yeah, that's a very good point about that. I think the other thing would be, I would say, to talk to the doctors that you have, to your personal doctor, and identify as clearly as possible, when would you have, say, an incubation? And what are the conditions under which that might happen? Sometimes those are temporary, and sometimes they're not. So there's a lot of decisions we have so many ways that we can keep people from dying nowadays. So that's one of the challenges, so, yeah. And one more, and then we're over our hour, so thank you, Jan. Glad you arrived.
Well, I thought it was at 3 o'clock.
It used to be.
Well, I seem like I've been here all day, like you.
Did you want to say something about this?
Yes. The other thing, if any of you are from out of town,
Out of state.
out of state, and
Right.
this is not your state, state laws are different.
Right.
I had no trouble when my husband passed. We had everything in place, but they actually never asked for it. And that was in Michigan. So, you know, and I've been told by other people that Arizona laws are quite different from other states.
Now, we're at the end of our hour. You have helped me to make a decision about one of our future presentations. So we'll have a doctor come and go over much more explicitly this issue about how to spell it out as clearly as possible and what your choices are. So, does that make sense? Arlita, were you going to say something else about that? Yeah. You're a nurse. You can enlighten us.
I forgot to tell you one thing about my mother. After she had been through that anxious period and then she was completely at ease, I asked her, why were you so anxious? And she said, Satan was trying to pull me into hell. You know, and then when the pastor said, we're standing on holy ground, that's when she was
She
totally
felt
at ease
released. How
again.
about that?
Yeah.
All right. Well, thank you all very, very much. That's very touching and moving. And we'll see you in a couple of weeks. Dr. Dahmer will be here in 2 weeks, okay? At 2 o'clock. Thanks.